Good morning. Good morning. Thank you. Good morning, ladies and gentlemen. My name is Campbell. I have the honor and the privilege to serve as interim president at Forest Park, a campus of the St. Louis Community College system. I've been here about 18 days, so if you don't recognize me, that's why. I want to thank you, Congressman Carnahan, for selecting our institution to host this important discussion. And thank you, Chancellor Zalima Harris, for the leadership that you provide St. Louis Community College to become a national model of workforce training. Forest Park plays a critical role in urban education and especially in the allied health sciences field. I'd like to share a few moments and a few facts with you. You may not be aware that we offer 13 programs in health sciences, education, and nursing. In the 2007-2008 academic year, we graduated 355 students who earned nursing and allied health degrees and certificates. Of those students, 153 graduated with associate degrees in nursing. Our 94% national pass rate for the nursing students exceeds the state's average pass rate of 87% and is 9 percentage points above the national average of 85%. 94 for Forest Park. That's fine. Thank you. Appreciate that. Having strong partnerships with every major hospital network in the city and the county of St. Louis, the overall pass rate for all of our health science programs is 92%. And that 92%, thank you, and that assures entry to the workforce of well-qualified, trained, and educated men and women as contributing members to our economy and productive members of our community. So clearly, you are in the right place this morning for the timely and critical discussion of health care. And as such, it is my pleasure to present Dr. Zalima Harris, our Chancellor and the visionary of the St. Louis Community College District. Won't you welcome her?
Good morning, everyone. Good morning, and thank you very, very much for being here. We're very pleased that you're here this morning, and as President Campbell has indicated, Forest Park is the perfect venue to have this critical discussion that will affect our community, our state, and our country. I'd like to add to some of the statistics that President Campbell gave about community colleges, because across the country, more than half of all nurses and first responders start their education at a community college. But increasing the pool of healthcare workers is just part of the solution. Too many citizens cannot afford basic health care, and the only time they see a nurse or doctor is in an emergency room. We are in crisis. But now healthcare in the state of Missouri has a champion, Congressman Carnahan. Congressman Carnahan comes from a family with a great legacy of public service to the state of Missouri and its citizens. And as exemplified by this important forum today, the focus has been on the needs of the unserved and the underserved among us. I especially want to acknowledge the support and friendship extended to those of us who work in the community college. In fact, the most prestigious award presented each year by the Missouri Community College Association is the Mel Carnahan Award. And I want to thank Congressman Carnahan, who has been a great friend to us and a real champion for our colleges and our students. He is also a member of the National Community College Caucus, which may find itself very busy this year in Washington, supporting President Obama's agenda for community colleges. And now I present to you U.S. Congressman Russ Carnahan.
Thank you, Dr. Harris and Chancellor Campbell, and for your 18 days here. Thank you for doing this, especially on short notice. But this was really prime time to have yet another meeting on healthcare. This is not new. Many of us here have been engaged in this debate for many, many years. But we have, I think, an alignment here of interest, of political will, of urgency that has brought this debate together, is bringing our country together in this great debate, as it should be. This is the way we should take on big challenges. But for too many years, this has vexed us. It has eluded us from addressing the needs of healthcare. So, special thanks to Forest Park Community College for helping us put this together. They mentioned many of the great things they're doing here, training the healthcare workforce of tomorrow. You are vital to what we're doing here. But St. Louis, we're known for many things. The gateway to the West, the best sports fans in America, many things. But we also are a center of healthcare, employment, and excellence. And so we have a lot at stake in healthcare reform. But you know what? We also have a lot to offer. We have some of the best institutions, best medical experts in the country, if not the world. And they have been very, very active in this debate. For that, I'm very appreciative. I'm here again today to continue my pledge and my practice to engage the people I represent in their government and the great issues of our time. I'm here to listen. I'm here to learn and really to work together for the change this country needs. We all know, we all have our stories that we can relate about how our healthcare system is broken. This truly is one of the greatest challenges of our time. And I think, as I said, prime time in the process. For everyone here this morning, I want to hear your comments, your ideas, a respectful exchange, even when we disagree, so that we can better hear and understand the issues that we face. And if we don't have the answers here today, we want to track them down for you. As I said, we have been at this debate for a long time. Since Missouri's own Harry Truman, and every president since, there's been great discussion about healthcare reform and getting it right in our country. But this debate goes on. It's been going on for too long. As I said, many times we have lacked the political will or the urgency to get things done. As a good example, in the last Congress, we brought up what we thought was the lowest hanging fruit in healthcare reform, children's healthcare. We passed it multiple times. It was vetoed multiple times, and we couldn't even get that done because of the political roadblocks. So right off the bat in this new Congress, we were able to get that passed, get it signed into law as just one example of moving forward in healthcare reform. The news last week, I know many of you followed it, but something very important happened last week.